Okay. As I stated in the introduction, you work in an emergency department as well as you work in parliamentary. Have you found that the new clinics have had an impact on the emergency departments?
Yeah, I think I can speak anecdotally, and then I can speak from the evidence that we're seeing as well through the numbers. I know that, and you're right. So just for your listeners as well, I still continue to practice in the emergency department at a local hospital as an honorary medical officer. So I do that on a volunteer basis. And I do that quite frequently as well. I do it for a couple of reasons. One, I love to practice medicine, and I'll always be a doctor. But also, too, it really allows me to have frontline sort of medical experience that I can then use to inform policy discussions with ministers and other members of the government. At least anecdotally from what I've seen, while the emergency departments are still quite busy, like I was talking about before with those complex patients, we are seeing reductions across the country in those lower acuity patients who are going to our urgent care clinics, which is good. However, in saying that though, and you only have to turn on the news or look at your social media feeds, there's still quite considerable ambulance presentations with older Australians or medically complex Australians that are making our emergency departments busy. And then also to those other confounding factors of, timely discharge, aged care, aged care bottleneck points with people waiting for either assessment or beds. So I'm not gonna sugarcoat it and pull the wool over everyone's eyes and say problem fixed. I can wash my hands of it. Health is an ever evolving specialty and area that needs to be addressed on an almost constant basis. But these clinics are making a difference when it comes to those lower acuity patients, which then again leaves us to do that complex medical care and those emergency sort of level cares that are required.